How do you differentiate between a thyroid cancer and a benign thyroid swelling? If it is presenting along with lymph nodes, it is likely to be cancer. If it is growing rapidly, it could be cancer. Or if there is any breathing difficulty, it is more likely to be a cancer. So what does thyroid surgery for cancer involve? Basically, it requires either a hemithyroidectomy if the nodule is single and less than 2 centimeters, or it will require a total thyroidectomy if the nodule is bigger or multiple nodules are present. Hello, I am Dr. Avinash Chaitanya, head and neck surgical oncologist. Today, I will be telling you about thyroid cancer and its treatment and its complications. So basically, how do you differentiate between a thyroid cancer and a benign thyroid swelling? Not by much, but there can be some signs that it could be cancer. One, if it is presenting along with lymph nodes, it is likely to be cancer. If it is growing rapidly, it could be cancer. Also, if there is any change in voice prior to surgery, or if there is any breathing difficulty, it is more likely to be a cancer. So, why breathing difficulty is because thyroid cancer can sometimes infiltrate into the windpipe, which is very close to the thyroid gland, and that causes stridor, which is breathing difficulty and noisy breathing. Even benign tumors can cause breathing difficulty very late in onset, mainly because of pressure effect or if it goes retrosternally. So once a patient comes with a thyroid swelling, we have to evaluate them with the help of ultrasonogram of neck and an FNAC and the thyroid profile to ensure what kind of a thing we are dealing with, whether it is a benign or a malignant lesion. And based on that, we have to go for surgery. Why do we need FNAC? Why do we need to know whether it is a benign or malignant before surgery? Is to determine the extent of surgery. Sometimes even large nodules on one side, if they are benign, we do only a hemithyroidectomy, that is removal of half side of the thyroid, but not a total thyroidectomy. But same thing, if it is a big nodule and there is only on one side, we would prefer to do a total thyroidectomy for the benefit of further adjuvant therapy. So what does thyroid surgery for cancer involve? Basically, it requires either a hemithyroidectomy if the nodule is single and less than 2 centimeters, or it will require a total thyroidectomy if the nodule is bigger or multiple nodules are present. Also, if we have an evidence that there is clinically or radiologically lymph node involvement, that is, it can be either in the paratracheal region or in the lateral neck, then we will do a neck dissection of the same side. So the aim of surgery in thyroid cancer is to remove all the disease and the thyroid tissue in the neck region. So if there is no nodes, only a total thyroidectomy will suffice. If there are nodes, then we will do a neck dissection also. Why should we do this? So that all the macroscopic thyroid cells are removed from the neck, and after that we can give an adjuvant therapy in the form of radioactive iodine. What the radioactive iodine does is it goes into the thyroid cells which are microscopic and left behind because we can't see them with naked eye, and they will kill those cells, particularly those cells. So it does not have much of side effects. It does not require many major treatments like radiation or chemotherapy most of the times, but very simple adjuvant therapy in the form of a syrup which contains radioactive iodine, and that can cure your disease with a cure rate of more than 90% over 20 years. So don't neglect any thyroid swelling. Get it checked, get it treated, be cured. Thank you.